So
It's
let's
very
say
simple.
people have not done, paid too much attention in the early part of their lives. Let's say up to
Hmm.
the age of 40, 45, they've not really done too much. And then they begin to develop problems. So how can they ensure that at least what they've got, they retain? Are you saying that this is a process where once it begins, it kind of, the only way is to replace teeth?
I mean, that's too generalized because, again, when we look
Okay.
at the kind of problems that a person has, I mean, if they go to as I said, if they go to a dentist because they've got bleeding gums in their 40s, probably that is a case of periodontitis, and we'll have to see
Okay.
how much of bone level is remaining. And I mean, a lot of things need to be taken into account. But generally, what I also tell my patients is, now that this is catching up, as in preventive dentistry is slowly catching up. The first appointment with your dentist right now, I mean, if you have not been to a dentist in the last 10, 15 years, or never in your life, the first appointment is always going to be really expensive, because we'll have to holistically correct everything in your in the patient's mouth. We'll have to take I mean, it's just not about addressing the patient's complaint alone. I mean, if the patient says, I've got complaint in the lower left backtooth region, I mean, we don't just address that complaint alone. We'll have to tell the patient that these are the problems that you have, and if you don't get it corrected, then these are the complications that can happen, and that, I mean, it'll further cause a lot of hindrance to their day-to-day activities as well. So the first appointment is always going to be a little expensive in terms of their, because we'll have to completely take care of their oral health, and post that, it is just maintenance phase. In our foundation, we say it's curative and rehabilitative. So we have the apex of our focus as preventive.